Hi there, I'm Dr. Marion Maloof. I'm here to talk to you today about acid reflux. Acid reflux is a pretty serious problem, but it's also related to a nervous system dysfunction. If you look at my chart here, within the brainstem is the first section of the spinal cord, and inside that is more specifically the control center for the vagus nerve. The vagus nerve sends branches out to the heart, the lungs, and every single organ in your digestive tract. The problem happens when the top bone of the neck, which is the atlas bone, when it gets out of place, it puts stress and pressure on that brainstem. And also when it gets rotated, it restricts the blood supply and oxygenation going to it. So if you're putting pressure on and restricting the blood supply and oxygenation going to a particular area, that area is subject to malfunction. So that being said, if that's a control center that's malfunctioning, then everything under that control center's control is going to be subject to malfunction as well. So by getting yourself evaluated for an atlas misalignment, getting that corrected, restoring the blood supply and oxygenation to the brainstem, to the control center, to get that working like it's supposed to, chances are your symptoms are going to go away and you won't have acid reflux anymore. So now people might ask, well, is acid reflux, is it a condition of too much acid? Is it a chemical problem? Is it just that my body makes too much? Or is it a nervous system problem? It's definitely a nervous system problem. One of the main issues that happens is when the vagus nerve malfunctions and there's not enough of a signal to get to that lower esophageal valve, the one that's right on top of the stomach. If the signal's not getting right there where it's supposed to be, then that valve is going to be hanging open a little bit, and it's going to regurgitate some of that stomach acid into the esophagus. That's why you're going to feel the burning and stuff like that in there. So when you clear this out, and you get the pressure off the nervous system, you restore the function, and you get the signal back down to that valve again so that valve can stay tight and stay tightly closed, chances are your problems are going to go away. So the very first thing you need to do is, if you have acid reflux, you need to be evaluated for an atlas misalignment, because rather than take a Prilosec or a omeprazole and basically treating the symptom, you have the potential to treat the cause or get the cause fixed and get your body working normally on its own, so you don't need that stuff. So it happens, and I'm Dr. Marion Maloof, and if I can help you with this situation, please give me a call. 770-923-1111, 770-923-1111. Thank you and have a great day.